Nearly 1 in 5 Boston residents live in poverty. Now, that's according to the latest data from the U.S. Census. And it's why city officials are looking into sending monthly cash payments to residents under a certain income threshold, something known as guaranteed basic income. City councilors heard from experts and officials last week and explored how established guaranteed income programs in other cities and states could work in Boston.
What have they done? How have the outcomes fared? Many of the findings are still preliminary, as I mentioned, so we are evaluating what kind of scope is feasible, what would the costs look like based on that, what do different levels of income mean for families. So what is the difference between receiving $600 a month versus receiving $1,000 a month?
So how likely is it for the city to implement guaranteed basic income, and what would it look like for the people of Boston? Well, joining me to talk about it is Boston City Councilor Kendra Lara, who sponsored last week's hearing on this issue, along with Jessica Ridge, East Coast Partnership Director for Up Together. That's an organization which advocates for direct payments as a solution to poverty. Welcome to you both. Thank you so much for joining us.
Thank you so much, Crystal, for having us.
Thanks for having us.
So, Councilor Lara, talk to me a little bit about what made you want to bring this up? I mean, other than the obvious factors as the rent is too dang high, right? Among other things. But, in drafting this particular ordinance and program, talk to me about wanting to bring that as a body.
Well, I think that, I've often taken a stance that the personal is political. And as somebody who grew up living under the poverty line with a single mother, I think that I'm personally very familiar with the struggles of working class families here in the city of Boston. And when I came into public office, I knew that economic opportunity needed to look like more than first-time home buyers classes. And it needed to look like more than just support for small business owners, that we really needed programming that was going to focus on our most vulnerable and the families that are struggling the most. Right now, the bottom 20% of people in the city of Boston live on just $14,900. And so a guaranteed basic income program has proven across the country and all across the world to really have an impact on lifting those families out of poverty.
So talk to me a little bit about that, Jessica, because I understand that Up Together has distributed more than $195 million in cash payments to more than 200,000 people across the country. That's since 2020. So talk to me about the impact of that.
Sure, that's correct. Up Together is a national nonprofit, and we've been working in Boston for 13 years specifically, and we have distributed that amount of money, $195 million, over to 200,000 people across the country since 2020. And we've been involved in some of the studies that have happened, evaluating the effects of cash on people's lives. There's numerous studies that are out and about across the country. What they all show is pretty similar, that families spend their money on basic needs, keep the lights on, help pay their rent, as you referenced, Crystal. And they also use it to think about what comes next. So it helps them stabilize enough that they can start thinking about longer term goals, going back to school, thinking about their health, thinking about their children's health. And often they're supporting each other, others in their community who don't have access to the cash. It's pretty clear from study to study. Up Together is actually in Boston, worked on a study called the Trust and Invest Collaborative, a randomized controlled trial. It finished in May. We are awaiting the data analysis from that and look forward to coming back to share that data. But the stories that we're hearing from families about the impact on their lives is real. If I have a moment, I'll share one story of Sanai, who was able to finish her college degree because she knew she would have that 18 months of $500 a month payments.
So, Councilor Lara, talk to me a little bit about what this would look like for Boston residents who would qualify.
Well, I think that is the conversation that we're having right now. Okay. What does a guaranteed basic income program look like in the city of Boston? We have families that could be receiving anywhere from $600 to $1,000 a month. We're looking at the threshold. How can these direct cash payments really have an impact? What income threshold would these cash payments be the most helpful to? And the funding mechanism for it, and who would be delivering the payments? Would it be a collaboration between our community-based organizations and other partners? There are organizations in the city of Boston that are already implementing guaranteed basic income programs like Up Together, United South End Settlements, Camp Harborview. And so we are really in the ideation phase of what basic income program could look like for the city of Boston. So we're not really having the conversation on whether or not we should have a basic income program. I think that we are past that. We are very much in agreement that this is not only a program that works and that's transformative for people who are living in poverty, but that this is something that we should definitely do. It's just a matter of what it looks like and when it happens.
Yeah, well, I mean, there were some critics at the meeting that were pointing to uncertain times, that we haven't recovered from the pandemic as a city in Greater Boston. So to then spend this amount of money on something like this, where maybe another program might be successful. I mean, what did you say to those folks?
I think that the economic uncertainty is exactly the reason why we need a guaranteed basic income. We are in the middle of a housing crisis. People are struggling to not only pay their rent, but they're struggling to really pay for their basic necessities because we haven't recovered from the pandemic. A family receiving $1,000 a month cash payment from the city or from a community-based organization is going to help them ensure that their rent is paid. And that helps our small landlords, and sometimes it helps our developers. And in Chelsea, for example, they spent 75% of the $2.1 million used for a basic income pilot on food. And so we're talking about putting money back into communities that is going to be put back into the city's economy. We saw it with the stimulus checks. We saw it with the earned income tax child credit nationwide. We're talking about pulling 2.9 million children out of poverty. And that's the kind of impact that we can have here in the city of Boston. And so although the argument was presented as something that should stop us from looking at basic income, I think it's an argument for the need for basic income in the city.
Jessica, you know, you and your cohorts have to make this argument across many different communities in the country. And, you know, there are folks who will say, well, why can't they just apply for public assistance for federal dollars? And, you know, why can't these folks just get a job? I had to get a job. You know, you always hear that argument when you're talking about universal basic income. What do you say to those folks?
Yeah, the stories that we've been told our entire lives about what causes and ends poverty are not true. They're completely wrong. We've all been fed these stories about welfare queens, people cheating the system, pull yourself up by the bootstraps. What we hear, what we see, families are working often multiple jobs, trying to make ends meet, or they're trying to struggle for childcare. They have an opportunity to get a raise, a promotion at their work, but if they do so, they lose their childcare. There's ways that we have set up our current systems of care at the federal and state level that have actually made it harder for families to get ahead and stay ahead. And so for Up Together, making this investments in people is really one of the best investments we can make in human infrastructure. And it supports the work that people are already doing in their communities and makes it a little bit easier for them so that they can actually do more, work more, be stable, get their kids the education that they need.
So the data bears that out, that when people get, and I think you mentioned a little bit about this, but when people have this basic income or get these checks or get this funding, they actually do work more and contribute to the economy.
Yeah, they're able to stabilize in the work that they're in. They're able to go to school. That's a common one that we see. Their housing is stabilized. It is not borne out in the data that people work less. If anything, they work more.
And from our research, we looked at both conditional and unconditional basic income programs, both in the country and all across the world. And all of the preliminary data that is available shows the same, that there is not a decrease in the workforce. And I think to just piggyback a little bit of what Jess is mentioning is that when families have an inability to really pull themselves out of poverty, a lot of the times it's a lack of financial resources that's keeping them there. Even a basic income pilot that could last for 2 years could make a difference in a single mother's life, that she says, I know that I have $1,000 coming in every single month. I can work less hours and go get an associate's degree. That now gives her the ability to be able to work a better paying job and helps move her and her family out of poverty. And so we're really talking about that impact, whether it be additional resources to have more childcare, to go back to school, to have more childcare, to work more hours, to say yes to a promotion. There are so many systemic barriers to really pulling yourself out of poverty that can be remedied by giving people direct cash payments. And this is not a new idea. Dr. King said it himself in 1967, right? That the remedy to poverty is going to be the universal basic income. And so now in 2023, we're still having the same conversation, but I think it's an idea and a policy whose time has come.
So it wouldn't necessarily be an indefinite basic income kind of idea, but more of like starting over a few years?
Well, I think it depends on who you talk to. I think that I am a supporter and see the benefit of a pilot, of starting. I think we've seen success in the city of Cambridge with implementing a pilot, learning, iterating, and now they have over $20 million for basic income based on the hearing that we just had last
very
week.
High test scores among the kids.
100%.
Yeah.
I think poverty impacts so many. This is when people talk about the cost of this, if I may just backtrack a little bit, we're already paying for poverty. Poverty shown to impact health outcomes, educational outcomes, well-being of our communities. We are paying for it. We are paying for it already. And when we look at basic income, when we look at the ability to really ensure that not only families but our children, right, the poverty rate in the city of Boston for children is at 27.7%. It is higher than the poverty rate for the entire city. So we're talking about families, but we're also talking about setting our children up to really be able to have their best shot to thrive and to really.
And basically, from what it sounds like, it's like we spend the money here, but save the money in other places, in other, crisis supports that happen in the city.
Absolutely. I think it's the same argument that we make with healthcare. Is you invest in prevention and you save money on the other end for treatment. And I think that is one of the things that we see with poverty, is that poverty impacts so many outcomes, socioeconomic outcomes in our cities and in our working class, Black and brown neighborhoods, that we really have an opportunity to invest in prevention right now.
So what about the argument about how do we pay for it? Like, do we have the money to pay for something like this?
I think the resources are there. I think the resources are there in philanthropic dollars. I think the resources are there with private dollars. And I think that we just need to really get a coalition of people who are interested in really reducing the poverty rate in the city of Boston to get together and have a conversation about where we get those resources from. Boston is an incredibly rich city. And in spite of the fact that our median income is over $70,000 a year, like I mentioned earlier, 20% of our population are living significantly below the poverty line. And that's the federal poverty line. We're not talking about the actual cost of living here in the city of Boston and how many people are struggling to get by. So yes, I think that if we really make a case to the goodwill of our partners, both philanthropic and in the private sector here in the city, we can really get the funds committed to have either a pilot or a permanent basic income program in the city of Boston.
Yeah, Jessica, it seems like, $195 million, you're able to find the cash somewhere.
The cash can be found. It exists in our city. It's about making this choice. And also by implementing guaranteed basic income, you're also giving choice back to people whose lives have been so affected by policies over time. I'm thinking about Lita in Cambridge from the Cambridge Rise Up pilot that we did. And to your question about the question that often comes up about work, she worried about running out of gas every day to work until this infusion of cash came into her home, and she was able to do a lot of things with that, including get therapy for her kids and reconnect with her community and stabilize at her job because she didn't have to worry about the impact of running out of gas. And so for me, we can invest in people now. We don't need to make the Litas and the Sanais of our city wait while we make some investments in those who are really struggling at the poverty line, at or below the poverty line, while we put together a group of some smartest people in this city to think about this. Philanthropy, private business. We have plenty of community members who have been impacted by direct cash over the last 3 years. Let's get them in a room. This can be figured out. It is being figured out across the country.
All right. Well, we're going to have to leave the conversation there. Jessica Ridge and Kendra Lara, thank you so much for your time.
Thank you so much.
Thank you for the conversation.
Yeah.